Alaikum, and welcome everyone to the MCB British Muslims and COVID-19 webinar talking about the Evens survey. My name is Dr. Wajid Akhtar, and I wanted to introduce myself and my guests over here today on this really important discussion that is about an issue that is affecting not just the British Muslim community, but the British community as a whole, specifically ethnic minorities, of which many are Muslim. So to begin with, I'll introduce myself. My name is Dr. Wajid Akhtar. I'm the Assistant Secretary General for the Muslim Council of Britain. I'm also a doctor, and I'm helping lead on the COVID response groups for the Muslim Council of Britain, as well as with the British Islamic Medical Association. Part of my role is to try and help coordinate the work that's been going on in the Muslim community and adapting the guidance that's been taken from the government and making it applicable to the Muslim community. Alongside myself today, we've got Sister Zara Muhammad, who is the Secretary General of the Muslim Council of Britain, the youngest Secretary General and the first female Secretary General of the Muslim Council of Britain. But before that, she was also the first female president of the Federation of Student Islamic Societies, and she's also a leading member of the Muslim Council of Scotland. So Sister Zara is someone who's probably well known to a lot of you and has spoken a lot about Muslim issues on a wide variety of topics, especially in the last year or so. And with us, I'm pleased to say we have Dr. Nisa Finney, who has researched and written extensively on ethnic inequalities in Britain, and particularly in relation to housing, community cohesion, segregation. Her work includes the book Sleepwalking to Segregation, Challenging Myths of Race and Migration. And she's also a reader in human geography at the University of St. Andrews. She's a member of the Center for Population Change, CPC, and a founding member of the organization which is behind the Evens survey, the Center of Dynamics and Ethnicity, better known as CODE. And she's a lead for CODE's Evidence for Equality National Survey, the Evens survey. So welcome, Sister Zara, welcome, Dr. Nisa. Thank you for joining us today.
Thanks, Wajid. Assalamu alaikum, everyone.
I just wanted to begin by framing the discussions around what's been going on with COVID at the moment. So, you know, there's not a single person in the country, young or old, who doesn't know that COVID has impacted the entire country and the entire world. It's continuing to impact many people physically and psychologically. It's affecting us economically as well. But there is definitely something different about this disease that we weren't expecting right at the beginning. There was almost a period of time when we were going through this pandemic where it became obvious that ethnic minorities were disproportionately affected, disproportionately impacted. And, you know, we had to take a step back to say, you know, the virus can't be racist. It can't be discriminating against people. So what's going on here? What is the problem? Why are the numbers of people who are being affected so disproportionately coming from ethnic minorities? One of my brothers worked in the Nightingale Hospital, and he said that it was just row upon row of ethnic minority, young to middle-aged ethnic minority, men and women there who, you know, you would just be absolutely surprised to find someone from a different ethnicity over there. And I think this comes to the heart of why we're here, because we want to find out what's going on. We have a feeling that there's something not quite right here. There's something that needs to change. There's something that needs to be looked into in a little bit more detail. So let's dive right into it. Before we begin, I want to pose a question to Sister Zara. The pandemic has impacted us in many ways, as I mentioned, but in your own words, what do you feel was the early impact of the pandemic on the Muslim community specifically?
Thank you so much, Dr. Wajid, for that introduction. And I think really important setting of the context. And I think if we go back to, you know, just over a year and coming up to a year and a half now, would you believe? I mean, there was a real sense of fear and panic, you know, because this is something unlike anything we've ever experienced before, but also, you know, the death rate was increasing alarmingly. And given that we are so overrepresented when it comes to, key workers, frontline doctors, NHS staff. We know that some of the first to pass away were actually Muslim, doctors and health practitioners. We know that, mosques were dealing with this unbelievable issue of, well, doing a funeral service is really a community affair. And it's something that is, there's physical contact with the body, there's prayers, there's rituals, there's a graveyard, and we're being told we can't do any of that. So there was this real crisis of, well, how do we adapt to this constantly changing circumstance? We're getting very little clarity and information from leadership, from government. Nobody really has a sense of the gravity of what's going on. And local communities, I think lots of WhatsApp messages were being shared. There's a lot of fake news. And I think on the real kind of cusp of what was about cremation, are we going to be cremated? So I think there was a real sense of panic. And, we were so grateful as part of the Muslim Council of Britain to provide that national platform to bring together so many different parts and cross sections of society, from bereavement, from the charity sector to the BIMA and the medical sector, the mental health, brought all these different groups together to say, okay, look, we need a coordinated response. We need to be able to provide clear guidance to communities. And I remember one of the first few webinars we hosted, over 1,000 people were on, and so many couldn't get onto that. And it was about the cremation and burial and bereavement. And I think the people that really suffered those early losses were the ones that had the least amount of support, and that probably are still enduring right now because they did not get to say goodbye to their loved ones. And and the economic impact obviously was further down the line. So I think at that first stage, it was really quite severe in its impact. And I think the point that you made, Wajid, about is COVID racist, or can does COVID discriminate? The problem is we had latent health inequalities that were just perpetuated further. We had latent health inequalities. I think we kind of woke up and said, why are we being disproportionately impacted? And we'd known, I remember later on, we said, well, ethnic minorities were disproportionately impacted from the beginning. We know we've got socioeconomic issues. We know the public health issues are there, but nobody did anything. And we're still in a place where no one's still doing anything. And we're talking about, vaccination. So I think certainly there was a lot of challenges and a lot to coordinate. The most important thing for us as the MCB was to provide that support, guidance, and I guess a little bit of calm and hope that actually we'd be able to move forward.
Thank you so much for providing that context. Dr. Nisa, if I could come to you, take us through the journey, because I'm assuming that the Evens survey wasn't, there in this form, at least, before COVID. So in those early days when none of us knew what was going on, we were all panicking. What was it that kind of led to the formation of the survey and that showcased to you and your colleagues that we needed to do something about this in the empirical way that you're planning to do?
Yeah, thanks, Dr. Wajid. And as you and Zara have outlined, it became clear to us in CODE very early on that the effects, not only the health effects, but the broader social and economic effects of COVID-19 were really differential across ethnic and religious groups. And so CODE's been working for 8 years to look into the patterning and the processes of ethnic inequalities in the UK. And it became very clear to us early on that this was a real issue right now in the heart of this pandemic. And the inequalities which we had already evidenced as very stark and very persistent were, as you have said, being exacerbated by this pandemic. And furthermore, we were concerned as a research centre about the stigmatisation and the racialisation of the disease and of particular places associated with Muslim and other minority communities. And we thought, how can we evidence this? How can we document what is happening, document the different experiences right now in order to ensure that responses, both in the shorter, but particularly in the medium and long term, are going to pay attention to the distinctive experiences of different communities? Because we weren't confident that those data were there. And indeed, we are even less confident now that those data that can really inform very bespoke and effective interventions from here on in were not there. And so we were fortunate enough to put together a successful bid to fund this very ambitious, ground-breaking survey, the most comprehensive survey ever in the UK of religious and ethnic minorities, which will capture people's experiences over the last year. And just to build on what Zara said about the lack of coordinated response in the early stages, we absolutely saw that in the initial work to build Evens and to build partnerships, including with you. And we see some of the early results from Evens really corroborating what you've said. And these are very early, very indicative results. The survey's not closed yet, closes at the end of the month. But for example, we ask about trust in Parliament in the handling of the pandemic, both UK level and the devolved regional and national administrations. And Muslim participants in the survey so far, early results, showed that there is lower levels of trust in UK Parliament among Muslims than there is amongst the average respondents to the survey. We also have questions in there about bereavement, an issue I know that you've reported on in your recent report. It's a really important issue. We have questions in the survey about that, about bereavement services, and to have that evidence that will comprehensively capture and enable comparisons between groups, I think can be a really powerful platform for the action that now needs to happen.
Thank you so much. Something you said there really struck a chord. During the pandemic, especially during the first wave, and when the vaccine was being rolled out, there was a feeling amongst quite a few ethnic minorities that we were being very, subtly called out as letting the side down. And we were being made to look like we were scapegoats, maybe because we were dying in disproportionate numbers or being affected in disproportionate numbers is because we were disproportionately not following the rules. And when you're a member of the ethnic minority, you kind of feel like, am I being paranoid? Is it just me? Or is this actually happening? Does the fact that 10 different news organizations call me this morning to ask me about how few Muslims are actually getting vaccinated mean anything? Or is it just because it happened to be something on Reuters that morning? Sister Zara, did you find that there was any kind of a feeling that maybe the Muslim community or ethnic minorities themselves were being targeted?
I mean, there was a couple of things I think that came to fruition. One was about the idea that we weren't playing our part, and the media, unfortunately, was reporting that Muslims were breaking the rules. We were praying, we were coming together, we were, socializing, and that just continued to reinforce this idea that, some people aren't it's the Muslims, look at them, they're not supporting the national effort. I think that was very damaging, but was very quickly challenged because the image in question was from years ago from something else. So I think there was certainly this feeling that, seriously, are we going to have Islamophobic tropes in the heat of a pandemic? I mean, are we really going to go there? But I think what was wonderful to see, though, was the contrast where mosques were working with public health authorities, where later on mosques became vaccination centers and food hubs and food banks. I think what we found was that there was a lot of people left behind in this pandemic. Rich and poor were unalike, and mosques especially played an important role in facilitating support, even if people couldn't physically access the space. And I think, part of this pandemic has been not just the battle of, public health, but also in public perception in the case of Muslim communities, which is, well, we're not going to be marginalized. Our death rate is high. We're actually suffering from a bereavement point of view. We're trying to be on the front line of supporting local communities. And I've heard from, other politicians say that if it wasn't for faith communities, some people really would have been left behind because that provision was not there. Where would you go to, from the Gurdwara to the synagogue to, the temple or the mosque? Who else is providing that additional care and support? But then also the tropes, right, where people are trying to stigmatize different parts of the community. And I think Muslim communities certainly felt that people are trying to, this perception that we're not playing our part, we're not doing our bit. But I think what was great was it was just so phenomenal, the contribution side, that no one could deny it, really. that it's been so widely acknowledged in British Muslim communities, and their part has been played really well, whether that being key workers on the front line who also had to do Ramadan fasting in amidst, delivering frontline services, and whether that be teachers, doctors, or bus drivers, as well as just the small, the families. And I think one last point I'll make is about there's a real consequence to family life, and many families, especially in Muslim communities, very diverse, with big extended family networks. And I think whether that was cramped conditions with lots of family members, or whether that was family members being really isolated from one another, I think even within ourselves there were so many challenges to overcome. And doing Ramadan in a way that we'd never done it before really tested our community, and actually said, well, no, we're staying at home this Ramadan and the mosques are closed. I think.
Thank you so much.
Yeah.
Dr. Nisa, on that same point, when people felt stigmatized, when people felt like maybe they were being misrepresented, there was also a sense of powerlessness to how do we get across the true story, the true picture of what's going on and how we're being impacted. And would you say, because it strikes me that the Even survey is actually a very positive and comprehensive way of and doing something about that feeling. If we felt like that, would you agree?
I would agree. I think that the survey can be seen as an opportunity to make your voice not only heard, but make your voice count in the actions that are taken, because it will allow this comprehensive review of how people have experienced the last year, and enable comparisons between groups. And we really, for us, it's really important to get this comprehensive coverage of the diversity of experience. So we hope that the survey is very accessible. It's an online survey at evensurvey.co.uk, but there's also a free telephone number, and it's in 14 languages. Everyone who completes it gets a gift voucher, because we appreciate you giving us half an hour of your time and your experience. But that information, I think, is really valuable to the longer term efforts to address some of the issues of inequalities that have already been raised, but also this stigmatization that we've come to now, and not only of groups, but of places too. And I think those two go hand in hand in the geographical imagination of race and racialization that we have in Britain. And another very early finding from the survey, because I hoped with these findings to illustrate the kinds of data that the survey can generate. An early finding which asks about unfair treatment and feelings of unfair treatment on the basis of religion or race has found that Muslim respondents were more likely to feel that since the start of the pandemic, there has been an increase in unfair treatment overall. And we have a really large set of questions in the survey about racism, discrimination, unfair treatment. And I think this is particularly useful in understanding the workings of discrimination and inequalities, and what the correlates or the associates are with those, to try to really direct the actions that need to be taken.
Thank you very much. I mean, I think you've said it really well. If you don't want somebody else to speak on your behalf, then fill out the survey and put your opinion across. I mean, that's fantastic, and it's great that we're being given an opportunity to do that. In what you said is the largest survey of this kind. So we really should encourage the Muslim community and other ethnic minorities, everyone to speak up and do it in this kind of comprehensive way, which will hopefully guide, I believe, like if somebody's looking to change policy or to make substantial decisions, where else are they going to go except for the largest survey of this kind? Great.
And can I just come back on that, Dr. Wajid, because when I've been talking to people about the survey, I've really had a feeling amongst the community groups and amongst the partners, of which Muslim Council of Britain, we're delighted is one, that people think this is a good idea. Yeah, we want to document these experiences. We want our voice to be heard, but there's a real lack of people being convinced that this survey will do anything. Will it really do anything? No, we've filled in surveys. We've been asked numerous times our experiences. Nothing has changed. As Sarah pointed out at the beginning, we still see these inequalities, these stigmatizations. When crises hit, it's the communities that are already suffering disadvantage that are disproportionately affected. What difference will this survey make? I think there are a few things I want to point out about why I am convinced this survey can really make a difference. Firstly, there are no data like this. There are no data that comprehensively capture ethnic and religious minorities in the country. You either have data that gives you big populations, like the census, which you have hopefully all filled in this year, or you have survey data that's really rich in the kind of questions that are asked, but really poor in capturing Muslim experience and other ethnic and religious minority experience. We don't have those two together, the sample and the detail, and this is what Evens can do. So that's the quality of it as a survey, and the partnerships there, the academic partnerships, the community voluntary sector partnerships are very key to that quality of the survey. So we've got the good data, but why might it work? And it's the partnerships there that are really going to make this do something, because our collaboration doesn't stop at the end of June when the survey closes. It goes on. We work with our partners to say what analyses are needed, what data are needed. We've got this rich source. How do you need this to be developed to address the issues of concern to you, to get the message across to policymakers, to other stakeholders, to keep this on the agenda so that action really is taken? This is going to be a very powerful resource to do that, a very unrivaled powerful resource, and one where there is a partnership of 13 organisations across the country, as well as buy-in from other stakeholders that can support the use of this survey after the fieldwork is finished.
You make me want to fill it out twice. I'll only do it once, I promise. I won't mess up the data. That's fantastic, and I love that you answered the question that could be on people's minds, that cynical question of whether it could make a difference. And I would absolutely back up what you're saying on that, because moving forward, evidence-based information, data is going to be what's going to make the difference. And if we're not part of that evidence base, then we will not be part of the change that it brings about. So we definitely need to convince more of the Muslim community to do it. And I will try to see if we can get some ideas and numbers on how much more we can push the community, so that we can build a little bit of momentum in the last few weeks. We are lastminute.com people. Muslim time isn't quite GMT, it's GMT +2. Even if we are literally standing.
This is trade secrets. We don't tell everybody. We don't want to tell everybody how we.
You will get a whole host of entries the day after the
yeah, we're gonna ask for a deadline extension. We're like the student that submits at 11:59 for 12.
I'm used to that kind of thing. Yeah.
Yeah, but we're changing it. We're changing that one survey at a time. We're going to change that reputation, Sean. So Zara, just moving on to slightly more generic question, but it allows me to tie into something a little bit more wider scale than the individual, is any reflections that we're a year on from the start of the pandemic on whether it's the community response or the places of worship? I know you touched on it, but any generic reflections that you wanted to touch on?
Yeah, absolutely. I think we've changed, and I think things have changed, and I think we have to accept that places of worship have had to operate differently. So aside from things I've touched on in terms of contribution and giving back, I think from what has this meant for places of worship moving forward? And I think we've highlighted things around, accessibility and digitization. We've highlighted things around still continue to provide pastoral care and congregations. But let's also talk about some of the negative consequences that places of worship will now have to address moving forward. Okay, so aside from the feel-good stories of community contribution and all of those things, we're talking about economic consequences, So mosques haven't been able to have that same stimulus, you know, the Friday congregations coming in, you know, and they still have outstanding utility bills, you know, there's buildings, we still have costs, right? Running costs don't go. So we know that there has been a knock-on economic consequence. Islamophobia and targeting, unfortunately, even still with the pandemic, some mosques have still faced vandalism and targeting. And I think it was most recently in London, but also in places of the north. And of course, the global world continues, as does some of the Islamophobic behaviors. And then thirdly, I think it will, in the light of what we found with the consequences of the pandemic, how do our places of worship now function, knowing what we know that this pandemic has, you know, created? So in terms of our communities are really going to be going through a tough time. You know, so places of worship now have to think about what is our strategy for community engagement and community response. We know that for the people that have suffered bereavement and loss, that we're gonna have to do something around bereavement. There needs to be a grassroots led response to that as well. The economic consequences also extends to people being made redundant. You know, socioeconomic deprivation is already rife within our communities. You know, some of the lowest income workers are within Muslim communities. You've got refugee communities as well. So I think there's a lot here. And then the final one, which is one that, you know, as the MCB, alongside some of these that we've spoke about, is mental health. And I think places of worship, again, are going to be looked on for that spiritual and pastoral care. Like, what can you do? You know, my young people have been isolated, or I've, you know, not been able to get a job, or, you know, I've lost so many loved ones this year. I don't know how I'm going to cope. So I think there's going to be a lot of, I don't want to call it a burden, but certainly a pressure on places of worship that they're going to have to navigate differently. And I think certainly on us, a call to action as the MCB, which is how do we support them through that? And I think it's these small things that sometimes we forget, which is, you know, there's a lot of output, there's a lot of giving, but actually there's also going to have to be a lot of thinking and transformation, because that is the weight of responsibility on us.
Thank you so much. Dr. Nisa, these places of worship, I mean, after this webinar, you know, we might want to pick up the phone to our local mosque or local Muslim organization and tell them, you need to get your congregation to fill out this survey. This is important. But if I could put you on the spot a little bit, if you were speaking to someone who ran a large mosque and they asked, why should I, you know, I've got lots of different priorities. I need to try to, you know, sort out the economy, the salaries, and there's not enough donations coming in, and COVID secure. Why is this also something I need to prioritize? What's in it for my congregation or for my mosque?
I think the data that will come from this survey has the power to get the messages that I'm hearing about the stories and experiences of Muslim communities across to people who can make change at a governance policy level. And I think that's really important, that the knowledge of what works and the experiences are put forward to that level. And although I'm a social scientist who works a lot with quantitative data, I also work a lot with stories and qualitative information. But it remains the case that statistics are powerful in effecting change, in persuading people of the issues that exist and the reasons for those issues. And that's what these data will do. And that's why we really want to get not only a good number of participants from Muslim communities, but diversity of Muslim experience represented in the survey in all kinds of senses. We can do certain levels of statistical magic with the data, but we need a certain level of participation and diversity of participation to enable us to do that. So that's why we need people to keep filling it in. We've got pretty good Muslim participation so far, but not good enough. So we need people to keep doing it so that we have these really, really powerful data. I think there are two ways that the data is going to really get messages home that are supporting the kinds of things that you've been talking about. So firstly, it tells us things that aren't documented anywhere else. So the early results, for example, show that more Muslims than average from the Evens survey feel worried about future financial situation. More Muslims than average in the survey so far have an increase in feelings of loneliness over the last year. So there are particular experiences of Muslim communities which the indicative evidence is pointing to, that if we have really good participation, we can be very solid about these findings, and that's very powerful. But not to end on a negative note in terms of the kind of results that are coming through, and to back up what Zara's been saying, the results are also showing that there is a higher than average increase in sense of community belonging amongst Muslim participants. So it looks like a lot of these very early tentative indications from the survey are supporting a lot of the things I'm hearing coming through this conversation. But the data, I wouldn't go out and publish these as findings because the data are not there yet. We need to have this robust data set before we can confidently get these messages across to people who need to hear them. And the second reason why I think this data is really different and powerful is that we can identify and understand the risk factors, which you highlight in your recent report. What are the underlying risk factors that mean that Muslim communities have experienced this pandemic particularly harshly? And we can make those connections, we can make those links between different aspects of life, different living circumstances and experiences during the pandemic. And understanding these causes, these drivers of differential experience is the key to targeted and effective interventions.
Thank you. I mean, that's very persuasive, and I'm hoping that we'll be able to get that diverse group going. So if you are representing a mosque with Somali population in West London or a Pakistani population in the Northeast, that you realize that their voices are important and their health is important, therefore, to you, because they're your congregation, they're your community, and we'll get that across. That's fantastic. I just wanted to say that all those who are following along on Facebook, if you have any questions, please do put them there in the chat, and we will be able to ask a few questions towards the end. I'm hoping that we're running ahead of schedule, so we will be able to ask a few of our questions. One of the last, or the penultimate point that I wanted to talk about was we're now getting towards the COVID recovery, or the next steps, and we're about a month away from maybe potentially lockdown being lifted and the lockdown measures being drawn down. And it's probably as good a time as any to reflect on lessons learned, and what we hope we can take forward from this experience that we've all collectively gone through. Sister Zara, were there any particular lessons that you wanted to highlight or talk about in terms of the COVID recovery?
Yeah, I think I'll probably just share three key reflections, and then I think Dr. Nisa's got some questions to answer. But I mean, look, certainly the power of community spirit and the power of communities coming together. I think what we saw in this pandemic was this overwhelming generosity, this kind of zeal that we're going to do something, whether it's the local neighbors providing food to one another and delivery to elderly residents, to mosques, to community organizations. I mean, thousands of meals have been provided throughout this time. People have gone through marriages, and people have gone through like holy traditions, celebrations. I mean, probably the full cycle of life's experiences. We've had everything, but people have maintained a sense of hope, but also a sense of goodness and action. I think certainly this sense of community spirit has to be kept alive and renewed and strengthened, because I think that will be part of that maintenance of something has to change. And that's my second point, which is, our post-COVID reality. We've all kind of made a decision that we're refusing to go back to the status quo of inequality. And I think you've seen a real global kind of hearkening of, well, changes now, with George Floyd, but also with, countless reports and things coming out now, with the MCB being really strong advocates for change, is that, we need an inclusive society, a diverse society, and one that celebrates our shared success and partnership. I think COVID showed us the consequences of inequality, And I think so our second point is that we have to see a different future, and one in which we're all included. And then third and finally, which is I think it really comes back now to policies reflecting people and policies that are really in tune. One thing that we learned from COVID was that there was a certain amount of detachment from, the decision makers with all the big picture and what was really happening on the grassroots. And what was fantastic about the MCB and all of our communities coming together and that organizing is that when it came to the message of vaccination, we can make that message directly to whether it was imams and your local imam or scholars, right to the person, to the family members, to the elderly. Not everybody could be on IT and technology, but everybody was on WhatsApp. So we utilized all of those channels of communication. But what we found was people were feeling very disengaged with decision makers, with leadership, very confused. And I think, bringing this back to policy and to change is that we need policy to reflect real people's lives, not this theoretical, abstract, some people. And I think so many people have been impacted by COVID. Surely their stories can't be forgotten. Those that lost lives can't be forgotten. And for the future generations that are coming, we have to see something different, inclusive, and bold that says, yeah, inequality, we don't really fancy that anymore.
No, exactly. As Abraham Lincoln once said, a house divided against itself cannot stand, and we really need to stand. So, Dr. Finney, on that same point, the Secretary General put through her three kind of take-home messages or learning points from COVID. But even though as a academic, you're going to be extremely impartial with whatever the data comes through and the way you look at it. But do you have any hopes or ideas of what you would hope that you could do with the data going forward, and you would like to do with the data? How would you like it to be used, or how you would like to present it?
Yeah, I share Zara's hope for an inclusive future where the diversity of voices and experience is not erased from history. And that's what Evens really is aiming to do. But beyond that, I think there are three things. I'll have three things as well that I think I would hope for from this project. Firstly, that not only we have this one survey, but that this lays the way for a different data and evidence infrastructure in the country that properly documents the lives and experiences of religious and ethnic minorities. And Evens will not only give us wonderful, rich data, but it will lay the foundation for such a data infrastructure that properly pays attention to the difference of experiences, the causes of inequalities, and what is needed to address that. But secondly, that's only going to work if we work together. If the academics work with the faith organisations, with the community organisations, so that the work and the data that's produced is of relevance, is telling those stories, documenting those histories and lives in the voices, in the true voices, telling your truth, documenting in a way that you see it, and that to be communicated for this inclusive future to policymakers and others. So my third ambition would be that the messages that come out of this project and its broader impacts really are very powerful in maintaining ethnic and religious inequalities and the need to address them on the political agenda. And we've seen reports this year that have questioned the existence of racism, questioned the need for society, for government to engage with that. And and you can see Code's response to that, but that is extremely dangerous and goes against all of the vast and robust evidence. And so Evens, I think, will be a powerful way to keep these very important issues of inequalities on social and political agendas.
Thank you. Well, let's hope that all those 3 points and the previous 3 points, we get a little step closer towards that with the data. I do have a few questions that have filtered through, and if I may direct them, and I think we've touched on them a little bit already. One of the questions is that on the background of what you were saying, where there's been almost a intervention from governmental and institutional levels saying, how much does racism actually impact on communities or and exist in the institutional sense? If people are pessimistic about a survey being able to change minds, what would you say to them?
I think the evidence we have to date is unquestionable that racism exists and affects many people's lives on a daily basis in smaller or larger ways. And at Code, this is certainly something over the last 8 years that we've very strongly found in the research, which uses all kinds of different approaches and or studies all kinds of different questions. So for us, this is embedded, the racialized operation of our society, and yet we see very high profile responses saying that it's not necessary to look at these underlying issues. I question that, Code questions that, and one of the things that we hope the current programme of work in Code will do, including Evens, will show the contemporary forms and experiences of racism and discrimination. And because it's quite clear that many sections of our society don't feel that this is a real part of life for many people. And that needs to be communicated. That this still exists. This has not gone away, these experiences of discrimination, unfair treatment, racism. And Evens will do that in a way that hasn't been done before, because we have paid particular attention to questions about experiences of unfair treatment, discrimination and racism, and in different areas of life at different times of life. So getting at this idea of cumulative experiences as well. So we'll have an unrivaled resource actually documenting those experiences, and with the comprehensive nature of our sample, we can make comparisons between groups, between areas of the country. And I think that's going to be extremely powerful, holding to account of people who say this isn't something that needs addressing to bring us to this inclusive future.
Thank you. I did have another question that's come through. There is a fear, and it's not entirely unjustified, about data and how it's being used. We saw with the slightly awkward rollout of the NHS data opt-out program, where they were trying to change the way that data was being shared within the NHS, and there was almost a instinctive backlash against that, because people are so mistrustful of people who want your data and what are they going to do with it. What can we say to reassure them that their data is safe?
So the team is extremely experienced and extremely skilled in social research, first of all. And both the team for Evens, which is across 3 universities, Andrews, Manchester and Sussex, has been through the highest level of ethical approval through the university processes, and a major part of that is the data management, which includes the data protection. So nobody who takes part in the survey is identifiable within the survey data. We won't be able to tell who has given what responses. It's entirely anonymous in that sense. We do ask for personal data because we want to send you your voucher when you've completed the survey, and we also ask whether you'd be happy to be contacted again in future, which is completely optional. So we do collect some personal data. It's stored entirely separately from the survey data. I, for example, will never ever see that, and it's kept entirely securely. this is very important to us, that this is a robust survey. It's science. It's not a quick poll. This is robust science, and the integrity and ethical assurances in that process are as important to us actually as the sort of quality of the data that we get in the end. We want to accurately reflect experiences, but in a way that is respectful to the people who are participating in the survey. And that's partly why we contracted Ipsos Mori, a leading global survey company, to undertake this for us, because they are also subject to the highest levels of survey research standards from a commercial or private point of view. So we've got these dual assurances from the academic side and the Ipsos Mori side of the data protection, the confidentiality of those data.
Thank you. And I should point out that it's backed by a constellation of the top ethnic minority organizations in the country, present company included, hopefully, Muslim Council of Britain, but also Operation Black Vote, Migrant Rights Network, NHS Race and Health Observatory, the Runnymede Trust, and so many others. And I would imagine that all of them have done their due diligence, like we have, to say that this is something that's important. We're coming towards the end, and I just thought I'd go back to Sister Zara to say, if you could tell us why you think it's important that we get Muslims to complete this survey, because as Dr. Nisa had pointed out, we've got a few Muslims who filled out the survey, but not enough, not as many as we'd like. And the more that we have, the stronger the data. Why do you think we should make this a priority? Why should we get Muslims to sign up?
Yes, this is so important. I mean, if we know, we know based on evidence already that we've been the most disproportionately impacted, ethnic minorities, and particularly the Muslim communities, we've been disproportionately impacted. We know families have gone through a lot, trauma from bereavement, economic loss. Even from our faith point of view, we've been tested, we've had to do things in ways that we haven't before. But as communities, we've undergone a process of marginalization, Islamophobia, we've got all of these different challenges, socioeconomic issues, but it all boils down to this fact, which is, your experiences, what you're going through, and you can, shout about it to the moon, but ultimately the power comes through communicating that experience into a body of evidence that can help. It's like a tool of empowerment, right? We document it, we can showcase, this is all of our experiences. This is lived, this is true, and this is our reality. And with that, then we can say, well, look, we surveyed thousands of people around the country, 30,000 is the total for every even survey. And this is the proportion of Muslims impacted by these key three issues. Not only does that give us power as the MCB, but gives all of our community organizations, political representatives, and all of those lobbying and advocating for change to say, well, this is what the evidence tells us. You can't say that this is a biased opinion or an emotional opinion, but this is it. And I think from the MCB point of view, we're here as a representative umbrella. We want to showcase the diversity, but also the depth. And I think our communities would be doing an injustice to ourselves by not just submitting to this survey, but documenting our experiences and really showing that there is a change that we want. And that's how we get that. And although I can understand that people say, well, we've done this before and nothing changes, but I think we're at a point of change. I think really the atmosphere is for change. And I think we really are seeing a lot around equality and diversity and inclusion. And that, as new generations are coming forward, they're not actually going to be willing to stay silent on key issues that impact them. So I think this has been an important time for us. And I really do urge everybody, it doesn't matter what age you are, what your background is, even if you don't feel like you've had a really bad experience, just take 30 minutes out, cup of tea, get it filled in, get yourself a free gift at the end of the experience. But, know that you're actually doing something for the long term, and the cost was 30 minutes of your life, hopefully a valuable transaction, but certainly one that we would, urge everybody to make.
Thank you so much. Dr. Nisa, I'm not sure, did you want to do a run through of the survey? You can share screen, or we can go, it's up to you whether you want to just talk through it.
Sure, let's give it a try. I'll perhaps just give a little bit of an outline, then show you the entry to the survey. But thanks, Sarah, for that real support for it. Spot on. Yeah, half an hour, cup of tea, and hopefully we can together in these partnerships make some change. So the survey, it is 30 minutes. We appreciate that. We are giving you a voucher for that time. But hopefully it's interesting as well. So we ask quite a lot about demographics and household circumstances, things that have been mentioned before, people's living arrangements. We ask about economic circumstances, change in your jobs over the last year or so, whether you've been furloughed, for example, the work that you do, whether you've had to do homeschool. Have you had the facilities for that, such as internet, for example? We ask about health, physical health and mental health, with a good focus on the mental health aspects of people's experiences over the last year. We ask about attitudes towards the police and how those might have changed over the last year. What your ethnic and religious identity is, how you define it in your own words, we ask that. And we also ask questions about what that means to you in your life and how you express it in your life. We ask about access to services or lack of access to services, including bereavement services. We ask about trust in politics. And I may have missed out some of the things, but you get the sense of the real breadth of this survey. So I will show you the website where you can enter the survey. It's quite easy to remember though. It's Evens Survey with one s.co.uk, and you can enter the survey from there.
I think if you click share screen, we'll be able to see your screen, hopefully.
Yeah. Thank you for bearing with me there. So here you see the Evens website, evenssurvey.co.uk. Click here and you will go through to the survey itself, which is hosted by Ipsos Mori. Your experience of COVID matters. Take part in the survey. 14 days left. We've got the countdown clock here. And if you want to find out more about the survey, you can scroll down and have a look at some of the materials about the survey. As I said, it's available free phone on this number, and it's available both online and on that free phone number in these 14 languages, which is the first thing you'll be asked when you enter the survey page. There's a bit of information here about the survey, with again links to it and some of the promotion that we've had and some of the links to other code work, such as the code response to the Sewell report, for example. You can see some of the projects we've been doing with artists and others to try to promote the survey, and some of our partners have been speaking about the importance of the survey as well. So if you click on Take the Survey, you'll be directed to the website that's hosted by Ipsos Mori. And the first thing that you'll see is that you'll be asked about what language you want to take part in the survey. You'll then be directed through the survey, and it's quite simple to follow. You have a bar at the top that indicates the progress you're making with the survey. You can go away and come back. So if you need to put the kettle on again, when you're halfway through, you can go away, you can click back on the survey and it will take you back to the place that you finished. And it should take around 30 minutes of your time going through the screens. There's opportunity at all points through the survey to click onto the frequently asked questions, which are also available in all of the 14 languages. And should your questions not be answered there, you can contact the Ipsos Mori helpline by phone or email, or indeed, I am very happy to receive queries about the survey as well. You can see here it's taking a little time to load this Ipsos Mori page just now. Maybe we've got thousands of people on the survey completing it at this very moment in time.
Also, when you're on Zoom, the Wi-Fi will just be maximum.
Yeah, I was thinking that. I think maybe the Zoom's taking up all.
Yeah. So it should, when you click on it yourselves, it should very quickly go to this page where you select your languages. And I won't click through, but you get the idea that you can select your language and then you'll be asked some initial questions. Clicking through, obviously there's the information here about the confidentiality and such like. I have read it, so I can click on there and click next. Some basic demographic information at first, and once you've got through those, these are sort of eligibility questions. Once you've got through those, you'll be sent a link to the main survey, and this is because we are undertaking the survey in quite novel ways methodologically. So we're collecting this information up front to ensure we get the right distribution of participants. So in this survey, for example, and I will stop my screen share now, but in that survey page that I showed you, if you identify as white British, then you would be told you were ineligible for the survey. We will have white British respondents in the survey, but we're sampling them in a different way. So all groups will be represented in the end, but there are some filtering questions at the beginning. But you can see, click on the website, evensurvey.co.uk, and click through, choose your language, and you enter the survey or use the free phone number. So it's quite easy, 30 minutes, cup of tea, and contribute to making your voice count and really affecting some social change towards this inclusive future that we've been talking about.
I'm convinced you can do it in 15, 20 minutes. I actually raced against the clock to do it. So.
Okay.
No, don't tell people, because then they'll get put off, because I think it is really in depth, so it can take up to 30 minutes. I don't want to make people feel like it is a really quick thing. So, but you can go away, come back, but we want that in depth, really good quality data.
I think it's just a guy thing, unfortunately.
You're gonna redo your answers, Wajid? You're gonna redo your answers?
I'm saying you cannot finish this in less than 30 minutes. You'll have 1 million people try to fill it out.
Challenge, and now it's a challenge. But
oh yeah.
Before we finish, any final points that you'd like to make, Sister Zara, before we go?
I think, I mean, just really my thanks to you, Dr. Nisa, for, joining us today. I think it's been amazing just to get the kind of, even the little kind of, a bit of analysis we were getting, the scoop, and just some of that initial findings. And it's just, it really does capture your attention and you're thinking, okay, wow, that's really interesting. So I think a lot of the times we put surveys and things like research and, I'll deal with it after. But actually, I think the Even survey is really dynamic and it's so relevant, isn't it? It's so current to what we're going through. Certainly from the MCB point of view, we're going to continue to partner and support. I've made it one of my strategic priorities, diversity and inclusion, looking at women, young people, and underrepresented groups. So it's amazing that the surveys come when it's come, but it's about what happens after. And I think our firm commitment is about what happens after, that we want to see a change and we want to be a part of it. But from all of us at the Muslim Council Britain, sincerely thank you for your time today, because you are taking time out to share more than 30 minutes, an hour of your time to share something really important. And I think, our message is, we hope that on the back of this webinar, people have seen the benefit and, we'll also see the challenge. And certainly, share your thoughts. It's just 30 minutes, but seriously can make some real impact. So I think it's worth doing. But yeah, just my thanks.
Thank you very much. And Dr. Nisa, any final points from yourself?
I'd like to thank you for the chance to really have this conversation and try to get across our enthusiasm for this survey. I do really think it can make a difference. It is a timely moment, and I'm really grateful for this partnership that makes it such a powerful project, such a powerful data set. And I'll end by saying that this partnership, we hope from the CodeSign side, will be a long-lasting one. This collection of the data is the beginning, and it's really what we do with that. and the power for that to support the work of MCB and effect change that is our longer term ambition.
Thank you. Thank you so much. And I would like to just say something in closing to the Muslim community who are watching this. And even if you're not watching it, then we're going to take a clip and send it out to you, is that there are very many opportunities that have come around for us to complain, for us to be upset, for us to feel hard done by, for us to feel that the system isn't working in our favor, that we're suffering disproportionately, we're not represented the way we wanted to be represented, and that our voice is not being heard in the highest levels of government or of authority. And if we're going to progress as a community, then we need to move beyond the anecdotes and go towards the plural of that. And the plural of anecdotes is not data. We need to actually move towards gathering data. We must speak truth to power and confront ignorance with facts. In grammar, as in war, there is strength in numbers. And I will finish with words from the Quran itself, where Allah subhanahu wa ta'ala says, say, bring forth your proofs if you are truthful. قُلْ هَاتُوا بُرْهَانَكُمْ إِن كُنْتُمْ صَادِقُونَ. Allah subhanahu wa ta'ala says in the Quran to the people who are alleging things that are untruthful to say, bring forth your proof. So this is in fact a divine way of going about your business. If you want to deliver change, if you want to bring light to the world, then bring forth evidence, bring forth your proofs so that you can convince other people of what you're trying to say rather than it just being one opinion of many. Hopefully this is a really amazing opportunity that we have, and I thank the Code team, yourself, Dr. Nisa, and your whole team, because what you're doing is something that's going to be hugely beneficial for community cohesion and to strengthen the community and the nation as a whole. And I hope that the Muslim community will take that on board, our institutions, our mosques, our community groups, and the individuals, and support the survey. We have a few, there's a timer on the website. We have a few days left, and we will make sure that we make those days count. Thank you so much, everyone. I really appreciate your time. If you have any questions or concerns, or you want to work out how you can help get your community to take part in the Evens survey, then email us at covid@mcb.org.uk. That's covid@mcb.org.uk, and we will reach out to you so that you can be a champion to get this out there as well. And thank you so much, everyone, for your time. Take care, everyone. Assalamu alaikum.